Questions?
So what's it going to feel like as far as when is this going to be really uncomfortable? Is it going to be like no, I mean, while it's gone, laying down, going through it?
No, sometimes the lower eyelid, sometimes when I tease out that medial fat pad, the fat pad there, which you don't have much of, sometimes you feel a little bit of a little stinging. But I don't think that's going to be such an issue for you because you don't have that much of the medial fat pad. Once we numb you up, you shouldn't feel anything. Okay. But if you do, if you feel like a little sting or a little burning, say, Dr. Briner, I could feel that. I said, fine.
Well, there's not going to be anything like I'm going to react to it and then mess you up while you're doing something. Okay.
No, it's a very calm environment. We get you nice and settled down. We listen to music. I mean, everything is it's like a ballet. My staff knows exactly how I want it. I'm extraordinarily meticulous. Some patients talk. We chat. Some people fall asleep. Some people just listen to the music.
Well, I guess if we can fall asleep, that's not too bad of a thing.
No, that's not too bad of a thing.
I'm probably the chatty type, so.
That's fine. That's fine. And when you need to be quiet, I'll say, okay, let's just be quiet. There are a couple meticulous parts of the lower eyelids I need to be totally concentrated on. But once we do that, you're good to go. Let's see. You're going to have someone bring you. Okay.
We'll do that.
Yeah. Afterwards, we give you something for pain, and there's really very little pain afterwards. You'll have the Xanax to help you sleep. We're going to also prescribe a topical antibiotic ophthalmic ointment that you're going to kind of put in your eye and over the incision. Mm-hmm. We'll prescribe some eye drops to keep your eyes lubricated and some Lacrolube, which is like a gel to keep your eyes lubricated before you go to bed. The other thing I want you to do is before we do it is get some frozen peas. They really work well. They're like a bean bag. When you go home, you're going to take your medicine, you're going to keep your head elevated, you're going to put those peas over your eyes, and you're going to thank me because it's going to take away almost all the pain.
So what is the criteria to choosing what kind of thread you use? You say one of them is dissolvable and one of them you physically remove?
It's just experience. It's just experience. And the nylons that need to be removed are there for strength, and the other ones are there just to give it a little bit more of a nice.
So you're making that decision basically on how the cut goes and how it happens during surgery. Okay.
Lower eyelids, because I'm not taking much skin out, there's not that tension, so I can put absorbable stitches in. Upper eyelids, there's a little bit more tension, so I like a mixture. I like, if I put in literally 20 stitches on one upper eyelid, I want 5 to 7 of those stitches to be the nylons that need to be taken out. Let's see, any other questions? And we'll have to give you some prices.
I guess, how much black and blue would one normally expect?
It depends on you. Usually when I do upper eyelids, there's none. Lower eyelids, lower eyelids, some people bruise, some people don't. And sometimes I may get a little bit of a bleeder that we take care of in the operating room, and you may get black and blue, or you may not experience any black and blueness. But 90% of the lower eyelids, they will have some sort of bruising after we're done. It's usually not horrible.
And that goes away?
Yeah, it goes away. Sometimes it takes several weeks to go away.
Okay.
Eyelid bruises take a while, and you may just have to put on some makeup or a little bit of concealer, or wear your glasses. But some people bruise, and most men are okay. Most men are okay. And afterwards, there's not a whole lot of discomfort. There's really not. But we'll prescribe you some pain pills, and if you take more than 4 of those or 5 of those, I'll be surprised.
Activity-wise, after 48 hours, I'll be pretty much back to normal.
Well, no, I don't want you doing any heavy lifting or exercising. These are the sort of things we go over after. You can start doing some power walking and light stuff, but I don't want you doing anything that's going to cause any of those little capillaries to bust open.
But if I want to go grocery shopping or something like that, it ain't gonna be no big deal. Okay.
Yeah, I think you'll be surprised how easy this is.
Okay, good.
Yeah. Any other questions?
Yeah, this little thing.
Little cyst. Oh, that little ball.
Can you make that go away while you're at all this?
I'd be delighted. Yeah, we can take that off when you do it. When you do see me for the surgery, it'll be exactly like this. We'll go over everything before we give you Xanax, and then we'll just,
How far in advance do you need to plan the appointment?
2 months.
2 months. That's quite a while. Okay.
Yeah. You can do them all at the same time. You can break them up, whatever you feel comfortable doing.
Okay, I have a tendency I'd probably just soon get it all done at one time.
Yeah, because you're busy.
Mm-hmm. All right.
Okay?
Well, thank you. Appreciate the
Thank you for coming.
advice.
Yeah.